Ventilation. If the heart stops beating, isn't breathing irrelevant? This is a question we sometimes get. In fact, achieving the return of spontaneous circulation is related to oxygen content. If there is not enough oxygen or too much carbon dioxide in the blood, the likelihood of achieving ROSC decreases. This is why it is essential to secure the airway and perform ventilation during CPR. Positioning of the animal. Position the nose slightly upward. It's similar to how your pet walks while enjoying a pleasant scent. The neck and the tip of the nose should be in a straight line. The tip of the nose should not point downward. In this state, the nasal passages will close, and oxygen cannot get through, even with ventilation. Key points for rescuers. Exhale after getting into the correct position. When you exhale, close your pet's mouth like this, lay on your side, and exhale into the nostrils. Keep the mouth firmly shut and cover the entire area of the nostrils with your mouth. Caution: do not block the nostrils. Do not bring your pet to your mouth. Keep the breath to 1 second long. Do this twice. When you exhale the second time, pull your mouth away instead of keeping it on your pet. Use enough force to expand the rib cage to a normal size. Do not exhale so much that it swells up. Chest compressions will be interrupted for a long period of time, so even if the ventilation is unsuccessful, count it as one time. Please beware of infectious diseases. Pulling the tongue out to clear the airway is not in the recover guidelines. You can consider it if you can't get the air in properly, but it can result in air leaking out of the mouth. Getting the slippery tongue out of the mouth takes time, leading to a loss of time for chest compressions. Even if the tongue is in the oral cavity, pointing the nose upwards and breathing out through the nose allows your breath to reach the lungs. Perform 30 chest compressions, followed immediately by 2 breaths, and then chest compressions again. Continuing these actions is 1 cycle. Keep this cycle going for 2 minutes without pausing between each one. The first 2 minutes are crucial. Do not stop what you're doing, especially when you're calling for help. It is important to call for help while continuing with the chest compressions. What you need to do to get help is finding a veterinary hospital as well as a means of transport to get there. Use either your own car or a taxi. You need to check in advance if the taxi allows pets. When finding a veterinary hospital, explain the condition of the cardiac arrest clearly. As with the sample, simply asking your family members for the vet and taxi should be enough for them to understand the situation and act immediately if you take time to discuss arrangements in advance. If you have no choice but to perform BLS and take your pet to the hospital on your own, using the speaker function on your smartphone to call the veterinary hospital and a taxi is recommended. Refrain from driving to the hospital yourself. Driving while being upset can cause accidents. If there are multiple rescuers, switch roles for every 2-minute cycle. Even then, it is essential to take turns smoothly, avoiding interruptions as much as possible. But that being said, bear in mind that chest compressions and ventilation should not be performed at the same time.
部長
Now here are some other points to consider when performing Pet BLS. I'll give you a little quiz. Let's think about it and learn together. Here's question 1. What should you do if your pet passes out on the crosswalk? 1. Move it to the sidewalk. 2. Begin on the spot immediately. The correct answer is 1. Move it to the sidewalk. Please perform BLS in a safe place. Question 2. Can you use an AED on pets? 1. Yes. 2. No. The correct answer is 2. No. Question 3. What do you do after you perform BLS on your pet and get in touch with your vet? 1. Watch and wait. 2. Repeat until you hand it over to the vet. The correct answer is 2. Repeat until you hand it over to the vet. Take care to avoid heat strokes and other health issues, and repeat until you hand it over to ALS, Advanced Life Support. Gather multiple rescuers while sticking to the 2-minute cycle to reduce fatigue and assign roles to each person. Finally, question 4. What should you do if your pet revives by BLS? 1. Go to a veterinary hospital and see a vet. 2. Return home quickly and rest. The correct answer is 1. Go to a veterinary hospital and see a vet. Even if your pet recovers, no countermeasures can be taken if the cause is unknown. It could happen again, or an illness of some sort could go unnoticed. Be sure to go to a veterinary hospital and explain the situation to the vet for a checkup. That's it for the quiz. Do it the right way, in a safe place. Be sure to perform CPR properly until you hand it over to a vet or a veterinary hospital. Instead of talking about mastering technique, we'll discuss the important role you, as the pet owner, play. In the event of an emergency, like when your beloved pet passes out all of a sudden, it's human nature to panic. Panicking is even more likely to occur with multiple people present. This is when the presence of a leader matters the most. Even if there are people panicking or getting anxious, you must be the leader and calm down. You may panic with everyone else around you, or be hesitant about taking the role of the leader. But you're the only one who can be the leader here. As with human healthcare, it doesn't matter who the leader on the scene is. It is best if BLS can be performed as soon as possible. You may feel a little pressure after hearing these words, but the life of your beloved pet is on the line. And in order to save your pet, you're taking this course for the Pet BLS certification. If you gain knowledge and skills with these Pet BLS certification videos and constantly practice at home, you should have the ability to take the correct action. Put your skills to good use by believing in yourself and start with calming down. So what should you do as a leader? It's important to assign roles to others. A lot of people panic, not knowing what to do. Assign roles to the people on the scene. The main roles are chest compressions, ventilation, measuring time, and calling the veterinary hospital. These should be done according to the number of people present while taking it in turns. Just one calm and dependable person can make a big difference in the atmosphere. Naturally, you may feel anxious inside. But if you prioritize saving your pet's life, you should be able to calm down. That's why we have created these videos that let you learn anywhere, as well as this training equipment. Using these tools to train for situations that are as close to practice as possible on a daily basis is essential. If you have taken the first step to study for the Pet BLS certification for your beloved pet, you should be able to show leadership, even during emergencies. Believe in yourself and take action to save your pet's life.